Hello friend, welcome to Pelvic Health of New Jersey in Madison. I wanted to take this video and introduce ourselves and tell you what to expect on the first visit, because I feel pelvic floor therapy could be a little intimidating. Also, nobody knows what that is. Everybody's keeping it quiet. So I wanted to open the doors, welcome you, and tell you exactly what to expect from the moment you walk into our facility and what you need to bring, how the staff is going to greet you, how each room is going to be, where my hands are going to be, what conversation we're going to have. So when you come into a facility, you feel very comfortable and you know what to expect. So in our facility, we have parking in the back. It's free, lots of it. So feel free to come in. You don't have to rush. Park wherever you wish. It's not assigned. Come right in. Once you come in, you're going to be greeted by our office manager and our biller. The paperwork has already been emailed to you, so you don't have to fill much out. They take a copy of your driver's license and your insurance card, maybe sign a couple of more consent forms, nothing stressful. If you choose not to sit in our waiting room, which usually patients never sit more than 5 minutes, you will be welcomed into a private room and the door will be closed until the therapist is ready to see you. This is all about the comfort for the patient. This is an intimate treatment, and we feel that from the minute you come in, you should never be stressed out, and it's all about your comfort zone. So you tell us what makes you comfortable. So once you are welcomed into the room, the door's closed, it's very quiet, it's very private. All the beds are made out of, with clean linen and pillows. Every room has a theme. We have a book room, we have a flower room, we have a small purple room, and where I am sitting today is our bison room. The goal is comfort zone. The goal is for you to benefit from each treatment the most. So when I come in, I introduce myself, I sit next to you, both of us are dressed, no stress, and I listen to your story, because it is very important for me to know, what journey have you been on? Where did all this come from? How did it evolve? If I do not collect all that, then I'm going to be missing something that would help me eventually to resolve your issue. We are in the room together for 1 full hour. You have my undivided attention. I write quickly stuff down. I'm not in front of my computer. I believe looking into the patient's eyes and giving you as much attention as possible. And patients share a lot of information with us, relevant or irrelevant. We feel it's all relevant because we want to know, what's your home situation like? What's your work situation like? Where have you been? What have you tried? What frustrates you? What makes you happy? What's your fear? What's your trauma? All of it. If I hear you correctly and I internalize all that information and I write it down, I would be a very good teammate for you to tackle your condition. And then I tell you what our next step would be, which is a full hands-on evaluation. I usually do 50% orthopedic evaluation. So I look at your hips, at your legs, at your pelvis, at your posture, at your diaphragm, at your ribs. Sometimes I go as high as your cranium to see, what is your cervical spine doing? How are you breathing? How are you standing? What are your arches doing? Because they all play an important role when it comes to your pelvic floor. And then you lie down on a comfortable bed. You are fully covered. It's very modest here. And I will expose a small part, and I will tell you what I am treating, why I am treating. And if a patient says, I can't grasp the concept, then the models come out. We have plastic models that we could demonstrate on. And if a patient is slightly intimidated, then we have printouts. You could also take this home. So, because different patients have different learning skills. And then when I tell you why I'm working on it and how it benefits you, I feel patients are at ease because they realize there's a purpose. At the end of the treatment, when I have assessed your abdomen, your back, your outside pelvic floor, and if patient is comfortable, fully draped, and I put a glove on and a little lube, and I go internally, it depends what the patient needs. If it's a child, there is no internal work, and the parent is present in the room 100% of the time, and the parent sits next to me, so their eyes are on my gloved hand at all times. And when the session is over, within the patient's comfort zone, sometimes patients choose not to have internal work on the first visit. No problem. We have more visits. Some patients, they want to know it all. They're like, do it. I want to have a bucket list to go home with. So I would analyze it and Google it and do graphs and charts and printouts. Everybody has different ways of dealing with a dysfunction. And we accommodate to every single patient's comfort zone and learning skills. And when you're done, you are given a bucket list of what we're going to work on. These are all goals, right? So, and I'll say, I feel these are the priority, these ones can wait, but sometimes I see a pattern and I explain to the patient with how the body is developing a certain pattern. This is why they have a dysfunction. At the end of every treatment and evaluation, I ask a patient, do you have any questions? Does what makes you comfortable, what makes you uncomfortable? Is there progress? Is there lack of progress? I never want treatments to be stagnant. They always have to push the patient forward. True, sometimes certain treatments will leave you a little raw, maybe a little tender, but then 24 hours later you say, wow, I felt so much better. Whatever you did, do it again. Sometimes progress is you start to progress and you decline a little bit. Progress and decline. And we always say, you cannot improve linear. You always have to slide a little bit back because that's brain and nervous system learning, and then you project forward. We always slide back to pick up the momentum. So even if a patient comes into us and a little disappointed and said, I feel like I regressed by like 5%. We say, that's no problem because your brain is trying to catch up. Let's try it again. So I feel between the orthopedic, the neurological treatment, the outside pelvic floor, the inside pelvic floor, and the homework, and also talking neurologically to your brain, that's what makes this whole pelvic floor program very successful. Plus, you're always in a comfort zone. We never upregulate you because we're all living our lives in a fight or flight response.